Did you know that nearly 1 in 4 labours in the US are induced, and many of them use a drug called Pitocin? It's been called a lifesaver, but others see it as overused. So what's the truth? Is Pitocin a helpful tool or something to avoid? Let's explore the evidence so you can make an informed choice for your birth. In this video, we're talking about what Pitocin is, its history, its benefits, its risks, and some natural alternatives that could be right for you. By the end, you'll have a clear understanding of whether Pitocin aligns with your birth plan. So what is Pitocin? Well, Pitocin is the synthetic form of oxytocin, which is a naturally occurring hormone produced in your brain's hypothalamus. Oxytocin is often nicknamed the love hormone because it's released during moments of bonding, such as hugging, breastfeeding, and even during sex. But when it comes to labour, oxytocin plays a critical role in triggering and maintaining uterine contractions. So how does Pitocin work? It's administered via an IV. It stimulates the uterus to contract, mimicking what natural oxytocin does during labour. However, there's a difference. Unlike oxytocin, which ebbs and flows in your body, Pitocin is delivered in a controlled but steady dosage, often leading to more intense and frequent contractions. Pitocin is used to either induce labour when it hasn't started on its own or augment labour if contractions have slowed or stopped. The history of Pitocin. The story of Pitocin begins in the 1950s when scientists discovered how to synthesize oxytocin. It became the first polypeptide hormone to be made in a lab, and by the late 1950s, Pitocin was being used in hospitals to induce or accelerate labour. This innovation revolutionized childbirth, especially in cases where labour didn't progress naturally. It gave doctors a tool to reduce stillbirths and maternal complications associated with prolonged pregnancies. However, over time, its use has become increasingly routine, and some experts argue it's now overused in low-risk pregnancies. Now, I do want to talk about why Pitocin can be a valuable option for some women. 1. Inducing labour when medically necessary. When a pregnancy goes beyond 42 weeks or when complications arise like preeclampsia, gestational diabetes or fetal growth restrictions, Pitocin can safely induce labour and reduce risks for both mother and baby. 2. Avoiding risks of prolonged pregnancy. Prolonged pregnancies can increase the chances of stillbirth, placental insufficiency, and complications during delivery. Pitocin can help bring labour to a timely start, reducing these risks. 3. Labour augmentation. For stalled labour, when your body has started but contractions weaken, Pitocin can give your uterus the push it needs to progress towards delivery. 4. Potential to reduce cesarean sections. By helping labour progress, Pitocin may prevent the need for an emergency cesarean in certain situations. Now, let's address the risks, because no medical intervention comes without trade-offs. 1. More intense, painful contractions. Pitocin-induced contractions are often stronger, longer, and more frequent than natural contractions. While this can help labour progress, it also increases pain, and it may lead to an epidural earlier than planned. 2. Fetal distress. Frequent and intense contractions can reduce oxygen flow to the baby, causing abnormal heart rates. This is why continuous fetal monitoring is required when Pitocin is administered. 3. Increased risk of cesarean section. So although Pitocin can prevent some C-sections in other cases, particularly when the body isn't ready for labour, it can lead to failed inductions and a cesarean delivery. 4. Uterine hyperstimulation and rupture. This is rare but serious. High doses of Pitocin or prolonged use can overstimulate the uterus, increasing the risk of uterine rupture, especially in women with previous cesareans. 5. Postpartum complications. Pitocin might interfere with the natural release of oxytocin after birth, potentially affecting bonding, breastfeeding, and increasing the risk of postpartum hemorrhage. There's also been a discussion about whether Pitocin is linked to postpartum depression. A Cochrane review highlights that while Pitocin is effective, it must be used with caution to avoid these complications. If Pitocin doesn't feel like the right choice for you, there are alternatives worth exploring. So you could try natural induction methods. Techniques like nipple stimulation, acupuncture, and using a birthing ball can encourage your body to release natural oxytocin and start contractions. You could also try membrane sweeping. This is where your healthcare provider can gently separate the membranes from the cervix, which can trigger labour without medication. In some cases, your provider may recommend breaking your water to jumpstart labour if your cervix is favourable. 4. Expectant management. If there's no immediate medical concern, simply waiting while closely monitoring you and the baby can be a safe and natural approach. Every situation is unique, so discuss these options with your care team to decide what's best for you. Pitocin is a powerful tool that can be life-saving in the right circumstances, but it's not always the best choice for every birth. Understanding its benefits, risks, and alternatives gives you the power to make an informed decision. Remember, this is your birth. Advocate for yourself, ask questions, and make decisions based on evidence and what feels right for you. Let me know in the comments, have you had Pitocin before, or are you considering it? Your story could help someone else. And don't forget to like, subscribe, and hit the bell for more evidence-based advice on pregnancy, labour, and postpartum health. I'll see you in the next video.